Ready?
Okay. Yep. Let's go.
Okay. Hello and welcome back to the KCCMH Connection. I am here with RN, BSN, Sara Chacon, our quality director and risk manager here at KCCMH. How are you today?
Good. How are you?
Pretty good. Pretty good. So let's jump right in. You started here as an intern and worked your way into leadership. Can you walk us through that journey?
Yeah. So, I'm a part of this community. I've been living here since I was in third grade. So when I was interested in healthcare, the internship program was kind of just starting. So me and another classmate were hired and we were able to work for the summer and then got into healthcare after that. So got into nursing, kind of changed my path. I was actually looking into x-ray before and ultrasound, but then life changed, went into nursing school. Don't regret it at all. I love nursing and came back here after I got my nursing degree and worked 12 years bedside nursing. Lots of different fields on med surg. We had labor delivery, emergency room. I did that full time for 2 years, home health and hospice, and then found myself into quality and risk, which you never know where you're going to be. And here I am 5 years later.
So you've seen a lot of different aspects of nursing in the hospital.
Yeah, exactly.
And you've got to deliver babies back in the day?
Mm-hmm. Yeah, we did that for about 12 years and enjoyed so many parts of that. So, yeah.
Where did you go to nursing school?
So I went to Colby Community College and then I went online to get my BSN. And I actually just got that about 5 years ago.
Awesome.
So, yeah.
So outside of the internship, or like what drew you into healthcare? Was it the internship itself or were you excited before that?
Yeah, I've always just been kind of interested in healthcare. I think it was like in 7th or 8th grade, they give you those assignments that are like, hey, what are you interested in? And back then it was like, pediatrician sounds cool, So I kind of started there. And then in high school, it was kind of like x-ray. And then when I went into the internship, I was like ultrasound. Like I love ultrasound. And I actually applied for probably 3 years or so for x-ray schools and then ended up having my son and choosing another path because I was like, okay, I got these prereqs. You can have the same prereqs for x-ray, nursing school, PTA school. So I was kind of looking at all three of those. And I applied to Colby for a nursing school and got accepted that year, which was great because I'd been applying for x-ray schools the last 3 years and getting turned down. So it was kind of felt like it was meant to be.
I think that's a really good point you bring up because I think maybe a lot of younger people or second career people don't realize that it is a second application into like nursing school, x-ray school, PTA. And I think that's good for people to be aware of is that sometimes it takes longer than
you planned, but it works out at the end, because you're thinking, oh, when I'm 18, I should know exactly of everything, and by the time I was in nursing school, I was 23, I believe, had a son, was married, so life happens, but I think it happens with a purpose. So.
Yeah, for sure. So because you've had a lot of different experiences as a nurse or in nursing, how has that shaped your role now in risk and quality?
Yeah, so I'm really thankful that I did the 12 years of clinical bedside nursing because I feel like that has given me the experience to do what I do today, which is think of the patient first. Not saying that somebody who didn't do bedside for that long, but it's just, the steps, the workflow, and some of the things that we need to look at for process improvement. I can take that as being like, okay, this is how we did it. This is the workflow. What's going to be the best way to get that done?
Mm-hmm. And make it better.
Yep.
So tell us, what exactly do you do in your role?
Yeah, so it's a lot of other stuff other than just quality, but it's a director for any quality department. So it's for the entire hospital, including the clinic, helping them with process improvements, identifying things that we can make better. You can't manage what you don't measure. So data is a big part of it. There's state and federal measures where we're checking every month to see if we're not having any medication errors, that we're not having any healthcare acquired infections, that we're doing getting EKGs for patients who come in with chest pain at the right time from door to a read, stroke times, that we're keeping those high level of patient care safe and giving them the best care that they can.
So we have an infection prevention nurse. And so your role is different from that in that all of the other statistics about patient care, you manage, you monitor, and make sure that we're continually improving those.
Yeah. And staying up to those standards. There is submission, like I talked about data. So there is submissions on the state and federal side too that I do. But yeah, I definitely make sure that we are staying at those levels and, looking. Just because there's an infection or something that occurred, quality goes in there, risk goes in there to look at that too. And we are able to partner with that department and help them, assist them in whatever way. So I love working with the different staff here. It's been really good.
So it's very cool because even though you're not bedside nursing, you're still helping the patients every day to get the best quality care here in a really safe environment.
Yeah, I feel like so. I mean, we're always just looking for the highest standard, like I said, the highest standard of quality with our patients, giving them the best care. And the boots on the ground are great because there are hands and there are eyes and everything like that. But sometimes you get so overwhelmed with that you don't get to pull back and be like, hey, what's the best care? What's the newest thing out there? What's evidence-based out there? Don't have time for some of that stuff. So it's good to have other people in the background making sure that we're doing that.
Oh, that's awesome. And so you have been here at this hospital for a long time. What has kept you committed to KCCMH for so many years?
I've been here. I just had my 17-year anniversary here from starting my RN. That doesn't include my internship. And it's been I'm a part of the community. My family's here. I built a home here. I know the community really well. And I just am almost like maybe just glutton for punishment, but I'm just excited for the future when our board and everybody else talks about all the stuff that, that we can do to better our hospital. I want to be a part of that.
Yeah.
And it makes me not want to miss out. So right now I feel like I can do good. So as long as I feel like I'm making a difference here and doing good and that I have still a lot of passion with the community, then I'm going to be here as long as I need.
Yeah, that's awesome. And so you are involved in a lot of initiatives. What are some of the key programs that you work with or help lead?
Yeah, so for the last 5 years, we've been kind of in sunset, but HTP, or Hospital Transformation Program, that's a state Medicaid program that has helped with our patients on lowering Medicaid costs and also improving patient outcomes. So we were able to partner with Eastern Plains Healthcare Consortium, which includes 13 other hospitals we've been able to collaborate. I think before EPHC, we were kind of maybe, I wouldn't say against each other or competing against each other, but it kind of was like that. And so now we're working collaboratively together, and we have actually started a whole bunch of new programs because we're working together.
That's awesome.
Yeah. So, but HTP, has had lots of good things come out of that. Like I said, it is sunsetting, but we're trying to reduce opiates as a first-line drug in the emergency room. We want to have patients have follow-up appointments, so we're working with that care coordination with our Medicaid NHP regional 2 provider. We're working on screening patients for social determinants of health. Mm-hmm. That's housing, transportation, utilities, and food. If patients, they have to take care of their baseline needs before they'll go and buy their medications or, do anything that can be healthy because they have those basic needs they need to reach first.
Right.
EPHC has been great about that too because it's really lined a bridge with resources as well. So, yeah.
A lot.
And mental health. I don't want to forget mental health too. We've really done strides with that one as well, with just improving our partnership with Centennial Mental Health and having those follow-up appointments and evaluations for those patients that need as well.
And making sure that they get to those appointments, or asking them if they have access to get there, all of those kinds of things.
Yeah, exactly.
Yes. And so what are some improvements or changes that patients might not see, but that have made a difference in their care?
I would say some things like the follow-up appointment. I know back in the day, the only follow-up appointment we really would set is if we delivered a baby, then, here's your appointment to come back for the second PKU. And now it's if a patient's, been admitted to our hospital, that we're having that follow-up. I feel like we also have made lots of improvements with just care coordination, referrals, with our other partnering hospitals.
So going back to quality, how do you measure quality I mean, I'm sure all sizes of hospitals have different metrics. So how do you measure quality in a rural hospital?
So it kind of just depends. We have some rolling quality measures, but then if we notice something that maybe needs a little more care, needs a little more attention, we can always add anything on there. We have something that we use, is called a Plan, Do, Study Act, where you identify something that needs to be worked on, you collect the data on it, and then you get with your team and get that feedback as well. So, and really get a study like what's going on. So, I mean, like I said, there's a whole bunch of rolling measures that are required from state and federal that we'll probably do to the end of time. I've talked about stroke, EKGs, medications, for sepsis, antibiotics, and those kinds of different guidelines as well that we watch. But anything we identify through the hospital too. It doesn't just have to be in the nursing floor too. It can be lab, x-ray. Thankfully, I get to work with all the departments, like I said. So
anywhere that encounters patients, you're always looking for ways to make those places safer, better, more efficient?
Yeah. And thankfully, it's not just me. I am the one department, but it's a whole hospital. It's everybody's responsibility for keep the quality and safety of our hospital.
That's cool. So I talked with Beth. It's a team sport.
It is.
You're the captain of the quality team.
Yep.
Yeah, that's awesome. So, okay, Sara, so what would you want patients and community members to understand about the work you do with quality and risk happening behind the scenes?
I know we have our healthcare, it's our Hospital Quality Incentive Program. That's another Colorado State program that we do and participate in. We get incentive dollars for that. And they have created all kinds of different quality measures that we work on, process improvements on zero suicide, making sure all of our staff members are zero suicide trained, called Question, Refer, and Pursue, QPR. And so they do that. We also watch for, sepsis, healthcare equality for our patients. I'm trying to think what else is in there. Patient experience. So our surveying our patients and getting patient feedback. We want to keep that. We do have a customer service committee that we just started this year. That's something that kind of goes on in the background, but that's again looking at patient experience as well and trying to make our customers and patients have the best experience when they come into our hospital.
Yeah, so let's touch on that for a minute. I know people get so tired of survey fatigue, but they're so important, right?
Yeah, so that's how we get our feedback on a lot of stuff, other than somebody just calling and giving their information or, their feedback, a survey. And we survey the emergency room, our inpatient site as well. The clinic gets surveyed. We want to broaden that actually and maybe make it even shorter, a couple, just maybe 2, 3. We've even looked at the iPad thing. I know that has been going on in the specialty clinic where there's an iPad there and you just answer a couple questions. We're getting that. We want that feedback and we want to hear the positive and the negative. 'Cause like I tell patients when I do talk about some negative things is, we can't fix it unless we hear about it. So tell me, don't tell the community, because I can't fix it unless I'm told about it.
Yeah, that's a great point. And we do currently have one kiosk in specialty clinic and we're adding 3 more.
Yeah.
And so if you come to KCCMH and you see one of those kiosks, we'd love for you to stop by. It's 3 touch questions and it helps us, Sara, have immediate feedback so that if we need to make changes that we can do it right away.
Yeah. And then if we're also doing something great and we know it's doing good, then let us know that.
Yes. And we did start a kind of a shout out board because Sara in her surveys will get great comments about the care and we want our patients to know.
We want our staff to know as well. So, some of our patients will do a shout out in their survey by a staff's name and they should be recognized for that, for that great care that they did.
Yeah,
went above and beyond, taking care of my kid in the emergency room or something. So, yeah.
Yes. So the surveys, again, maybe not your favorite thing to do, but definitely help the hospital improve care, improve quality, and help us recognize the employees that are doing great stuff.
Yeah.
Yes. So at the end of the day, what does providing high quality care in this community mean to you?
It just goes back to when you say community is that we're here to take care of our community. We're here to deliver safe, high quality care to patients. We want to keep our patients close to home. We want to have people around the community, have the Kit Carson County Memorial Hospital be their first line to a hospital and to get their health care. So, that's going to be, like I said, a whole hospital effort. We have to have provider champions, staff, that are excited to come to work. And I can feel that every day, the culture has gotten really great and it's just a really good place to work. And I know when staff are happy, then our patients are happy as well. So,
yeah.
Yeah.
I believe that too. Is there anything else you'd like to leave our listeners with today?
No, other than, if you have any concerns or feedback, call the hospital. They know how to transfer and get a hold of me. And I'm happy working for the community and I hope to for a long time. And I'm just really excited for me moving into quality. I didn't know how many doors it opened and how much more of a challenge it would be, but how much I've learned. So I'm just really appreciative of being able to grow my career here.
That's awesome. I love that. Well, thank you, Sara, for taking the time to talk to us. And again, we would love your feedback. Sara will work tirelessly to make this place the best it can be. So we need your help in that. Anyway, thank you again for joining us on the KCCMH Connection. See you next time.